Hi there, students. We are back to learn OSPE, that is Objective Structured Practical Examination Questions. Today we will discuss in the series of knee joint clinical anatomy of menisci of knee joint. Now, please use earphones for better audio experience. Okay, now in this OSPE, you are given two figures 1 and 2. In figure 1, you identify A, B, and C and write the clinical anatomy of A and B. In figure 2, identify D and mention to which structure in the knee joint the D is attached. So the answers are rather 1A is medial meniscus, B is lateral meniscus, and C is the tibial collateral ligament, which is also called as medial collateral ligament. In figure 2, D is tendon of popliteus and it is attached to lateral meniscus of the knee joint. Now, clinical anatomy of knee joint, we always correlate with the gross anatomy. So, what does the gross anatomy say? It says that the menisci are fibrocartilaginous structures. They provide the smooth surface for the movement of knee joint and they make the movements friction free and painless. And hence, if the menisci are damaged or eroded over the years, the person starts getting pain during the movement and restriction of movement, and this is called as osteoarthritis. Now, menisci are eroded due to years of jumping. They are also eroded by locking the knee joint frequently and over the years. The degeneration also occurs because of the age. There are some causes, these are some of the causes of osteoarthritis related to menisci. Now, blood supply. Second anatomy is we know that the menisci are partially supplied by blood or they are partially avascular, whichever way you want to look at it. Now, they receive the blood from the periphery, only from the periphery. This is the periphery. The peripheral part receives, these are the blood vessels from the capsule and the synovial membrane, and this is the inner portion which goes between the tibia and the femur, and this is avascular. So, if this medial part of the meniscus is damaged, then the healing does not happen, or maybe it is delayed. If the damage is at the periphery of the menisci, which is supplied by blood, the healing can occur. It can also be repaired. Now, some more detailed anatomy of medial meniscus. Now, the medial meniscus, it is attached to tibial collateral ligament. Now, if you see this figure, this is a tibial collateral ligament. Its deeper portion is attached to medial meniscus, and because of this, the medial meniscus becomes fixed to the bones, tibia and femur, and that is why it is injured more often than the lateral meniscus. What about lateral meniscus? The lateral meniscus periphery is attached to the popliteus muscle, as we have already identified. Now, these are the meniscal fibers of popliteal muscle, and since it is a muscle, it will keep on contracting, unlike the ligament, which is medial collateral ligament. So, it will keep on pushing, or rather pulling, the lateral meniscus posteriorly and downwards over the tibial plateau and taking it away from the harm's way. The lateral meniscus moves about 20 to 24 millimeters, while the medial meniscus moves only about 10 to 15 mm. Hence, the injury to lateral meniscus is uncommon because it is moved before it gets crushed between the two condyles of femur and tibia, because popliteus muscle is pulling it back. So the role of popliteus is it pulls the lateral meniscus downwards and backwards over the tibial plateau. And when does that happen? When the knee joint is being unlocked. So when you unlock the knee joint, the popliteus contracts, it rotates the femur laterally and also causes a flexion. During this time, the lateral meniscus could get crushed between femoral and tibial condyles, but it doesn't because of the attachment of popliteus muscle. There is one more attachment, and that is called as meniscofemoral attachment. And meniscofemoral is a ligament which is attached from the lateral meniscus here to the medial condyle of the femur. It has got two bands, anterior and posterior. This is posterior cruciate ligament. So these bands go anterior and posterior to the posterior cruciate ligament and are attached to femur. And these also contribute in making the lateral meniscus more mobile during the flexion of the muscles. So the meniscal injuries and tears, they usually involve the medial meniscus. Lateral meniscus, we have already said, is rarely damaged. Pain on medial rotation of the tibia on the femur indicates that there is injury to medial meniscus. Most of the meniscal tear occurs in conjunction with, meaning along with, damage to medial collateral ligament or anterior cruciate ligament. A combination of the injury in which tibial collateral ligament, anterior cruciate ligament, and medial meniscus are injured is called as an unhappy triad of knee joint. Now, those meniscal tears that do not heal or cannot be repaired will have to be removed. Knee joint from which the meniscus has been removed is not does not suffer any loss of mobility, but little flexion may be not available. Okay, the joint becomes more unstable and the tibial plateau undergoes inflammatory reaction. Now these are the tears. This is longitudinal tear, you can see here. This is called as bucket handle tear, and this is horizontal tear. This also another horizontal tear, another horizontal tear. Okay, so now two types of injuries. Meniscal tear is bucket handle movement and horizontal movement. Horizontal movements, they usually occur at the attachment of the medial collateral ligament, just posterior to that or near abouts. These are some more tears. This is a complete longitudinal tear or bucket handle tear. This is meniscus has come out from the attachment of knee capsule of the knee joint. This is a posterior tear and this is a anterior tear. So these are the various meniscal injuries that happen. Alright. Now injury to medial meniscus and anterior cruciate ligament, as we said, and of course the TCL is an unhappy triad, and it usually happens in basketballers and footballers. Now the excessive lateral twisting of the flexed knee disrupts the TCL or the tibial collateral ligament and tears it and also detaches the medial meniscus from the joint capsule. This usually happens in the athletes who twist their flexed knees, and this usually happens in, as I said, footballers and basketballers. So these are the various clinical anatomies that you have to know. So keep a lookout for the next video where we will do locking and unlocking of knee joint. Thank you.